Today's morning medicine is Arsenicum Metalicum, which is metallic arsenic. The folklore. There's always a folklore in the beginning. That's what I usually read. The symptoms of Arsenicum Metalicum are very like those of Arsenicum, but not entirely. The following are the most peculiar. So Arsenicum Metalicum symptoms recur every 14 days. That's very interesting periodicity. Every 14 days they get this. Coryza, or thick mucus, every 21 days, which is very strange. Just like my mom now, I'm realizing last year we had a family picnic and she got the same bronchitis, whatever. They didn't even tell her what. She went to the doctor. They said something like a cold. I don't know. That's all she came back and told me. They didn't say bronchitis, pneumonia, this, that, whatever. So, and as a child, I had bronchitis or walking pneumonia. And so, now I realize there's some kind of miasm, there's some kind of something that's been set up. I'm not going to get family history from her side because, yeah, she had a rough childhood. Pains extend from one part to another or leave one part and appear in another. So, in other words, you got a shoulder pain, and all of a sudden it leaves, it's gone, but now you have a knee pain. So nothing that's like connected. It's not like your shoulder pain, then it's connected here. It comes and it goes in different areas. Attacks can come on suddenly and go away slowly, or vice versa. It could come on slowly and go away suddenly. So, uh, do these things matter? They help you to determine between different medicines. Arsenicum metallicum has general weakness. So that's kind of like gelsemium. You'd have to determine between those. Thinking of symptoms aggravates. So they get aggravated when they think of them. Many symptoms appear on right side. Let's get into this up here. All right, so Arsenicum Metalicum, metallic arsenic. General weakness, thinking of symptoms aggravate. Right-sided. It's usually a right-sided thing. Doesn't always have to be, but it's more right-sided than left. Swollen feeling in the brain, head, eyelids, hands, and fingers. So they got all this feeling of swollenness, even if they're not swollen. Arsenicum Metalicum wakes up syphilis after dormant many years. So that's, when I looked up, you're going to see spleen stuff in there. Pain in spleen, down groin. Pain in the breast, pain extends to hip and spleen. So when I asked Dr. Google, I said, can syphilis affect the spleen? They said, oh, yes. So someone who's had dormant syphilis, why is it dormant? They've taken penicillin. Penicillin will kill the bubo, the wart or whatever it is that comes on the genitals from syphilis. It'll cure that. It'll take away probably other symptoms because it kills that bacteria. But when you do that, you suppress it and push it in. And like I always say, whether it's skin stuff and you push it in and it becomes asthma, or it's skin stuff and you use something to get rid of that skin stuff, a drug like they're pushing on the TV for eczema and all that, can go in and become, can affect your joints. Just like you take care of syphilis with penicillin, it goes in and attacks the spleen. So now you want to go in and work on the spleen, and you give a medicine like Arsenicum Metalicum for spleen problems, and guess what? The syphilis will come back. That sore on the genitals, the general weakness, all that stuff from syphilis will come back. I don't know what all the symptoms are of it, but those symptoms will come back. Now you keep giving Arsenicum Metalicum, and it'll push that syphilis right out of the person. So there will be no more syphilis problem. But you take that penicillin, pushes it back in, affects the spleen. So as you see, pain in the spleen, down groin, pain extends to hip and spleen. Okay, washing helps itching of anus and face. So, the anus is itchy, the face is itchy, you bathe, it helps. Hot bathing aggravates the hip, a sciatic situation. It aggravates it. That's very interesting. Worse, lying on left side, that's the heart. So when they lie on their left side, the heart has, more pain and problems. They're low-spirited, weak memory, desires to be alone. That's a 3. They don't want no company at all. Now that can, like a pulsatilla, pretty sure chamomile wants to be carried. They just don't know what they want. Pulsatilla, I think, wants people around them. I'm pretty sure that's what pulsatilis is. Uh, but they're annoyed by visions causes them her to cry. So they have these visions. They have these thoughts and these visions in their head. Uh, anyways, they start crying. So they're weeping. That's that low spirited. They're crying. And that's also a pulsatilis situation. Okay, like I said, pain in spleen, down groin, pain extends the hip from the breast. Pain in the breast extends to the hip and the spleen. So there's a lot of hip and spleen situations going on. All right, so face, red, itching, burning, and bloating. So the face is bloated. They got itching up there and burning with that. Eyes are swollen. That burning is the arsenicum part. Eyes are swollen and watery. They burn with coryza. So they got a lot of thick mucus coming out of the eyes. It's watery, or it can burn with thick coryza in there. So the eyes are watering, but they have thick coryza that burns. That again is the arsenicum part of it. Well, it is Arsenicum Metalicum, so that's why there'll be burning. That's why with my wife's headache, I said, well, what's it feel like? I come home, 10 Tylenol PM cell, I can't get rid of this headache. I'm like, okay, what's it feel like? I just come off of doing a marble job. I'm tired, I'm dirty, I want to eat. And I just asked her, I said, what's it, throbbing, stinging, stabbing, burning? What's it feel like? And she said, burning. She thought for a second, said burning. Arsenicum, went and got it, gave it to her. She was 10 minutes later, or whatever it took me to take a shower, come down. She's talking on the phone like nothing happened. It was gone. So, head feels too large, left-sided headache. So this is opposite than the right-sided thing, up to the eyes and into the ears. So the headache goes up into the eyes, in the ears. Headache worse stooping and lying. When they lie down, it's worse. When they stoop over, it's worse. It doesn't say what kind of headache, whether it's throbbing, feels too large. So there's that feels too large. Things feel, brain, head, eyelids, all that feels too large. Okay. Edematous, swelling of forehead. So they have a, edematous is fluid retention. So it's like a swelling, fluid is building up in there and it's swelling. I don't know if that's, like from sinus stuff or what, but liver, all these things that are skipped, the heart, the kidney. Now there's the heart, and it said lying on right side. Where does it say that? Lying on right side is worse for the heart. Up here. Left side, lying on left side is worse for the heart. But there's no heart, there's no kidney, so this medicine there probably should be more, if they do a more thorough proving of it, there should be more symptoms that fill in all these things. But from what I would have to think that the proving wasn't done fully. They did a proving, but it wasn't extensive, let's put it that way. Sore pain goes through to shoulder and spine from the liver. So they got liver stuff that comes up, the pain goes up to the shoulder and the spine. So this is that, what it said, the moving around. Pains will move around. Let's see, mouth. Tongue is coated white and shows imprint of teeth. Mouth is sore and ulcerated. So that always helps, is the coating of the mouth, or coating of the tongue. And they have sores and ulcerations in there. So that would help you to determine between a couple of different medicines. They have diarrhea, which is burning, watery stools, relieves the pain. So they have pain down there, and when they have this diarrhea, which is burning and watery, it relieves the pain of the bowels, once they go to the bathroom. And that's why, like my wife, I don't know what she's had, but I know between my mother and her, I think I got the one for my wife because I kiss her all the time since she's so cute. But from that, I felt miserable. I felt, I just was feeling rough. So I took some medicines and I felt better. I gave her some medicines. Now she had a cold sore, which I gave her Nat Mur for that. So the cold sore went away. Nat Mur could have probably helped take away the cold, but and I'm giving her medicine for her foot, for cold sore. I wanted to give her something for her cold. She said, nah, I'm not into it. So she's just miserable and angry, and just wants to bite someone's head off, so, but I took care of mine, and I felt better the next day, just like my mom. I gave her gelsemium, and I'm pretty sure gelsemium helped, because for 3 days she wasn't getting out of bed. She was coughing a lot, taking cough medicine to suppress it, uh, which I really don't agree with. If I could have got her a medicine for her cough, it probably would have cleared up the cough. But I gave her gelsemium. The next day after that Sunday, I gave her belladonna with it. So I wasn't sure. And I can't really act like I'm doing medicine with her. But anyways, the next day, that Monday, she was out of bed. Now I'm not able to if she was able to pond it and sip it, pond it and sip it, it would work better. But I just threw it in her drink, and she drank it. And the next day she was eating, which she hadn't really ate nothing for days. And she was out of bed. Now that Sunday, she got out of bed to come down and see my sister and niece and me, and she went right back up to bed. I don't even know. She didn't even eat dinner. And Monday, she came down, she ate breakfast, then she ate dinner. I don't know about lunch, but she was out of bed now and eating. She's still not better. If I could give her that, and I'm pretty sure gelsemium, because I went on the weakness, just tired, just want to lay in bed, and the cough, so I went on that. If I could get more symptoms in that, I could hit it more direct and clear that thing right up. She goes to the doctor. Oh, you got a cold. Okay. Sounds like bronchitis. My sister even said it sounds like more than a cold. Bronchitis, pneumonia, whatever she's got. She's still coughing. I really haven't been able to give her another medicine. But anyways, she's taking cough pills now to stop the cough. That's the whole idea between allopathic medicine and homeopathic medicine, is they want to fight it, stop it, get rid of it. Just like with syphilis, they'll get rid of it, but it goes in and attacks the spleen. They will get rid of the cough, but they didn't get rid of why the cough is happening, why it comes on every year at this time. So if I could give her something that would, go right in and do that, get rid of that, I could relieve her of that, and she won't have that again. It's going to come on next year. I don't doubt. So somehow I got to find her bottle of water, put in the proper medicine so that it doesn't come on. I got to look up and see every, what would I say, almost autumn gets this major cold, So anyways, but if you push that thing in, then you'll keep having that same situation. So this is all there is for this medicine. This medicine probably needs to be more, if we could get in with the allopaths. And I heard through one of the things I was doing with the people in UK, the HINT program, they were saying that now they're calling it, we're using minimal doses. They're not calling it homeopathy. They're realizing homeopathy is working. So they're trying to get into that realm without saying they're going to be with us with homeopathy. There's just a whole fight there. But the allopathic medicine, they fight against disease. They got a war against cancer. We treat the person. When we treat the person, their body, and that's our whole philosophy. When we get the right similar medicine to that similar disease they have, the body is what fights the disease. We don't fight the disease. We're not in a war for cancer. What the heck is this? What the heck? Something come up, something's trying to get into my stuff, man. There's so many hacking things going on. Boy, I tell you, yeah. Anyways, we're not in a war against cancer. We're not in a war against pneumonia or whatever, syphilis. We are in the business of healing the person. The person, once you put a homeopathic medicine in a person, they rise up and fight it, and it clears their symptoms. The vital force or the immunity, that clears up their symptoms. Unlike allopathic medicine, they're going to suppress it, fight it. Okay, we cured it. No, you didn't cure it. You got rid of the symptoms, but this person can still have that problem coming back on. Now, like I said, with syphilis, this one with syphilis, it says Arsenicum Metalicum brings out old syphilis symptoms, even if it's years, been dormant for years. And like I said, This person has a lot of spleen stuff, and if you Google it, it says syphilis can attack the spleen. So they're they're getting rid of the symptoms, and they're pushing that disease into the body, and it's going into the spleen. Like I said, if you have skin problems, eczema on that, you take these drugs that are marketing on TV, you get rid of the skin stuff, it pushes it in. Now you may have asthma. Now you may have rheumatism, arthritic stuff. Depends on what you're susceptible to. Okay, let's get into case taking. This is the real important stuff. Prognosis. It's more for chronic. So what's prognosis? Prognosis is what you're saying that they have, what the disease is, what the problem is, how you're going to treat the situation. This influences the potency you give, the repetition of the potency, and your case management. So, you're always trying to, you got to manage a case. So you give up medicine, it doesn't work, it palliates, or it does something that that it doesn't cure. So now you got to manage it by saying, okay, I missed, I got to go back in and look at it. That's why you make a paragraph. Now you can go back and look and say, oh, this is what I missed. This is the chief complaint that they're saying, but it's actually something else. And Robin Murphy does a case of, I don't know, the lady came in for back pains. I got these terrible back pains and all that. Well, here it was PMS. So if you went for back pains, you might miss and not give the right remedy. But what he perceived was this woman's PMS is causing all these back problems. So now you got to look at how many layers there are. Now a layer, as I always say, is, take my mom for instance. She's had that flu now, or whatever it is. It sounds like bronchitis to me. So she's had this bronchitis. Earlier, she fell down the steps, cement steps, got a bruise on her head. I gave her arnica. I slipped it in her drink. And so she had a fall there. Before that, she had that pneumonia again last year. Before that, she had a car accident. Now, she hasn't had this pneumonia before that car accident. So this car accident is a layer that brought out the pneumonia state, which is probably from her childhood, somewhere back there. And I'm not going to get a history from her. This brought out that pneumonia. I don't know how it got taken care of before, probably antibiotics and that. Oh, you're good now. Now she has a car accident. That accident put on a layer that brought out an old layer of pneumonia. Now she's getting it every year at the same time. I wonder when that accident was. Anyways, so these are all layers that are on there. So you'd first peel off the bronchitis layer. Then you'd go in and peel off the fall down the steps. Then you'd peel off, the next bronchitis layer probably won't be a problem. But then you go back to the car accident. Now arnica could take care of the car accident and all that. Now she's got her foot is killing her because she got a broken bone in the top of her foot. It's probably a fractured bone, and it swells up on her. And so, that's another thing to work on. So, yeah, these are all layers. So that's what you got to, how many layers are there? And that's where that paragraph, that's where that whole picture comes in. What is all the layers to this person? And you want to see this is number 2, is the degree of pathology. How serious is the disease? Well, and this prognosis is usually more for chronic situations. You got an acute situation, someone fell down steps, you give arnica, that usually clears everything up. They had a car accident, you give arnica. You could give aconite if they have more fear than the actual pain, but arnica is always good to start with for the trauma. So if you go in right away with an acute, an accident, anything like that, you go in with arnica, that'll usually stop that layer from forming. That'll repair, as Robin Murphy put it, the rip in the vital force that causes a leak of energy that gives you pain or gives you this situation. So now, number 3 is the person on medications. Do we have a medication layer? So taking ibuprofen for a long time, taking benzos. My son's been on benzos forever, and yeah, that's a medication layer. Do I need to treat that? Well, what he says is uh, we a lot of times need to treat what the meds are for. So my son has anxiety, always had anxiety all his life. If I go in with a medicine and treat the anxiety, which I never did, I was building a business, keeping the family going, all that stuff. I got rid of his, acute dog hair allergy, never allergic again. And I never went in and treated his anxiety. There was nobody coming. They weren't saying, hey, we need to treat his anxiety. He just went on these medicines, I don't know how long ago. But anyways, you go in, you can treat for the medicine because the benzos will kill you coming off it. It almost did a couple times. And I told him, next time you get those benzos, give me one. I will make a homeopathic medicine out of it, you know? And then you can take that, and that should relieve the situation with the benzos. But the real thing is treat what that medicine is treating. So in other words, it's anxiety. So go in, figure out what this anxiety feels like. Figure out why he has this anxiety. Go in and treat that anxiety, and then he can say, wow, I'm feeling a lot better. Maybe I'll take less of these medicines. And he's trying to take less. So less of the medicines. Keep taking the benzo that's been homeopathically prescribed, and eventually he might get off of that. But at the same time, I need to be treating why he has to take that medicine. Okay, number 4, you got to do curability. Can you cure? You got a cancer patient. Cancer goes into the bones, the liver, the brain, the lymph nodes, whatever. They're bedridden. They have weight loss. Are they on radiation? Do they have chemo? Are they taking pain pills? Curability determines our goals. We can palliate the pain. So in other words, and usually that's when we get people, when they're on their deathbed. The doctors finally said, well, that's it. We irradiated you. We gave you chemo. We've done surgery. You got months to live. Then they come to the homeopathic. Can you help me? Well, I could have helped you a lot better if you would have came to me at the same time you're going to the doctor. While you're taking chemo, this one here is cadmium. I don't know if I can get the cadmium sulf. Anybody taking chemo, I got that from Washington Homeopathics, which is up in the Washington, state of Washington. Cadmium sulf will help you through the radiation or the chemo sickness. Radiation, you give X-ray. We do have a medicine called X-ray. You can give X-ray to get them through that part of it. But while they're taking all these things, the pain pills, you can get them through this pain. Curability, now you don't know. They're on all this stuff. You may just have to palliate their pain, stop their suffering, and help them to pass, without a whole lot of suffering. The other end of it is curability turns our goals. So we palliate the pain, remove the suffering. So once you remove the suffering, this can lead to a general improvement. From this, you can determine the curability or not. So even like they come in, they say, I'm so depressed. Why are you depressed? Well, I got this knee pain and I can't get around. I can't do the things I need to do. And so you take care of the knee pain, the depression goes away. Same thing. You start removing the pain and the anguish and all the stuff going on with the cancer. They get feeling better. Their energy comes up. They're not weak. They're not bedridden anymore. Now you can determine, hey, maybe we can get in there and cure this thing, or not. Even if you get them to stop suffering so much, that is much better than them laying there suffering till they die and being on morphine and all that stuff. You can go in, remove the pain, remove the suffering with the proper homeopathic medicine and help them to either die peacefully, or now you can determine, is this thing actually curable? Can we take care of it? Just like the guy with the cancer on the ear. He went after the stomach because he had all this stress. And like I said, the emotional and the mental strain will put on physical symptoms. Vice versa. Physical symptoms like knee problems will put on mental symptoms. So you remove the symptoms and other things will clear up. Like he took away that stress with staphysagria that this guy was going through, because he said, oh, my stomach, if I could just get rid of this stomach issues I have, I'd be better. So he went after the stomach issues, and I don't know, 6 months or so, the ear started getting better. The cancer of the ear started getting better. You don't think of it being that way, that, you know, all this stress that you're under causes you, no, think of it. You got stress, now you get ulcers. You know, that's a direct result. You get a physical symptom from mental, emotional strain. So now you're determining curability because you want to see what is the goal here. What am I going after? How am I going to prescribe? What am I going to do for this person? Then you want, number 5, you want medical history and family history. You know, a lot of times you don't get that. You can't get that family history, but you can get the medical history usually. This helps determine their sensitivity to get certain illnesses. Also, they're hypersensitive or not. So you take the case and you see, wow, they keep getting the same situations, the same thing. They're sensitive to bronchitis. They're sensitive to injuries. They're sensitive to flus and colds. They're sensitive to whatever. If you don't have a sensitivity, that's why when a cold or flu or measles or whatever comes through the community, people, some people get it. They get it bad. Some people don't get it at all. Some people get a mild case of it. So even I've seen, you know, people go get their flu shot. Flu comes through, they still get the flu. Others who didn't get the flu shot, they don't get the flu, or they get a mild case of the flu. They don't have a sensitivity to that flu. You know, they don't have a sensitivity to the measles, you know, for whatever reason. So anyways, sensitivity is a big thing, and you can get that from family history and medical history. They continually get skin issues. You know, they got eczema all the time. They've got this or that. And when their eczema is gone, they get asthma. You know, so you can see their sensitivity and what they, you know, what they get. And you can tell a hypersensitive, you know, they've always got allergies. They've got allergies and they've got lots of them. That's a hypersensitive person. So then you have to be careful with the medicines, how you give them. You know, you want to dilute them out. I always put everything in water. You know, one little sugar tablet in water, and then, you know, whether they pound it or they don't, you know, you might pound it once and take it. You know, if they get aggravated, you back off. You put it in more water. You dilute. You take a drop out of that bottle of water, put it in another one. You can go out 3, 4, 5 bottles of water. That medicine is still in there because remember, we're going minus. You know, allelopathics go plus a 1, a 2, a 3, a 4 to given substance. We give energy -1, -2, -3. So if you take a bottle of water, that's why I said measles. I can go down to Texas, put morbillinum in a bottle of water, pound it 100 times, take a drop of that out, and you know, put it in a bunch of bottles of water. Now I got a ton of medicine I can hand out to everybody. That is like a prophylactic or like a vaccine for the measles. And then I can go and give a bottle of water. If I see everybody's measles, what is measles? Anyways, let's say Arsenicum Metalicum. I can give Arsenicum Metalicum, put it in a bottle of water, spread it out into a bunch of bottles of water and give it out. And everybody can take it and get healed from that measles if they got the measles. So once you have all this information, you make a paragraph. So you write out a paragraph to yourself, like, okay, I've seen this, I've seen that, I've seen that. So that way you get a whole picture. And that's what you want. You want a picture of this person, of what you see, of this person's vital force. To get a clear picture, you do a timeline also. A timeline means they had an injury here, the etiologies. They had an injury here, they had a flu here, they had a this here. You do a timeline to see when these things are. So that way, when you're managing the case, you get rid of the symptoms for the flu. You get rid of that stuff. Now you go back, oh, they had an injury. Now you see these injury symptoms come up. You get rid of that. You keep going back through the timeline. Now you got a timeline and you can see the clear layer go away. You know, you might have stages in the layer. You know, they get better, a little better, a little bit. Now it's gone. Now you see a different picture. That's the injury picture. Okay, now you go on that. You get through that, and you go back to a grief picture. You get rid of that grief. So you can work all the way back through their timeline. And you got that paragraph to always go back on to say, what did I see when I first took this case? Then you go to the repertory and materia medica. So then you go to these 2 books, the repertory, right? Which has the larynx. We just opened it up. The larynx, pressure in the larynx. What else is there? Pulsating, rattling in the larynx, rawness in the larynx. So that has all the different parts of the body and the stuff. Then you go to, like I'm doing now, there's phosphoricum. If that came up in your repertorization, you're looking up the different parts of the body and the different rubrics, you know, just like my mom. She has a cough, so I looked up cough, and she has hoarseness with that. So I looked up cough and hoarseness. Now I get a bunch of remedies. You know, now I take them remedies, I go to the Materia Medica and see which one matches her symptoms the best. The better you match it, the clearer your picture is, the quicker and the better your relief will be and the cure you get. So that is morning medicine. You can age, but you don't have to get old. Let's see if this turns on good.